We have made it to our last video in the 2021 CPT surgery updates. In this video, we will check out what's new for the 60,000 series codes. Hey there, if you are new here, welcome. And you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. The 60,000 series of surgery codes in CPT includes the nervous system, eye and ocular adnexa, and the auditory system. If you missed videos in this series, you can check them out here. The 2021 changes impact the nervous system and the auditory system. There are 5 deleted codes, 2 new codes, and numerous revisions to both codes and guidelines. Let's jump right in. But first, let me ask, are you interested in the health information profession, specifically medical coding? If yes, are you interested in getting medical coding education and training? And are you interested in information regarding PRN's online medical coding course? Again, if the answer is yes, let me invite you to our next online live Q&A information session on Saturday, April 24th at 10 a.m. Eastern Standard Time. To register, see the details in the description box. And check this out. Are you confused about all the medical coding programs, but unsure what to ask? Do you want to make sure you get everything you need to learn medical coding and become certified? Well, join me on the last Saturday of every month at 10 a.m. Eastern Standard Time, where I will answer your burning questions regarding medical coding. Join our monthly medical coding course Q&A session. To join us, click the link to register. Can't wait to see you. Code 61870, craniectomy for implantation of neurostimulator electrodes cerebellar cortical, has been deleted due to changes in current clinical practice and low utilization. Another code deleted due to clinical practice changes and low utilization in this section is 62163, neural endoscopy, intracranial with retrieval of foreign body. In both code deletions, a parenthetical phrase guideline has been added to indicate that the codes were deleted. Also deleted are codes 63180, laminectomy and section of dentate ligaments with or without dural graft, cervical 1 or 2 segments, and code 63182 that is for more than 2 segments. These codes were deleted due to low utilization and changes in current clinical practice as well. In the introduction, injection of anesthetic agent or nerve block, diagnostic or therapeutic somatic nerves subsection, the descriptors for codes 64455, 64479, 64480, 64483, and 64484 have been editorially revised as child codes to code 64400, as they contain similar language to the parent code 64400. Are you familiar with the concept of parent code and child code? If not, Check out this video for further explanation and examples of the parent and child code concept. Back in the first video of this surgery code update series, we talked about the addition of parenthetical phrase guidelines after, or a parenthetical phrase guideline after code 11960 to report the replacement of tissue expanders. Well, 4 exclusionary parenthetical notes have been added following code 64704, 64714, 64721, and 64726 to preclude the use of neuroplasty codes 64702 through 64726 with 11960. In addition, an existing parenthetical note following code 64721 has been revised by replacing arthroscopic with endoscopic. Due to the deletion of 99201, the cross-reference parenthetical notes following codes 69209 and 69210 regarding removal of cerumen that is not impacted have been revised with the removal of code 99201. Code 69605, revision mastoidectomy with apectomy, has been deleted due to low utilization in current clinical practice. New codes for nasopharyngoscopy surgical with dilation of the eustachian tube, i.e. balloon dilation, were established. 69705 is for a unilateral procedure and 69706 is for a bilateral procedure. An exclusionary parenthetical phrase guideline was added following code 69706 to indicate that code 69705 and 69706 should not be reported with code 31231, diagnostic nasal endoscopy, or code 92511, nasopharyngoscopy with endoscope. So you have learned about the new changes in the 60,000 surgery series. You have also learned the systems that make up the 60,000 series. And lastly, you have learned that I am hosting our next live Q&A information session on April 24th at 10 a.m. Eastern Standard Time. You will get exclusive information on our coding course specials, and I'll answer your burning questions regarding our online medical coding course. Check the link in the description box to register. Question of the day: was this information helpful for you? Also, did you learn something that you can apply? Let me know your responses in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or asking a question. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.